So has anyone here made a mistake? Hands up. Yes? Yeah, we all do it all the time. We all make mistakes. Can't find your car keys. Can't find the car. I made a mistake tonight. I misread the invitation. I thought I was speaking to TEDx men. But I'm here now, so we'll keep going. Okay, so we all make mistakes. We sort them out, and there's no harm done. Unless you work in a safety-critical industry. I'm an airline pilot. Do I make mistakes at work? Yeah, of course I do. I'm a human being. Can those mistakes cause harm? Flying an airplane at 500 miles per hour? Yes, they can cause very significant harm. Yet aviation is one of the safest modes of transport we know. So, what's happening? What's happening is error management training. We embrace error. We expect to make mistakes. And we have a system or framework in place to deal with that error. As long as we deal with that error and sort it out, if it's sorted out in time, we avoid having an accident and there's no harm done. It's all about time. Before I started flying 17 years ago, I worked in a different safety-critical industry. I was a surgeon here in Belfast. I was a trainee heart surgeon in the Royal and also in the Mater Hospital in Dublin. Did I make mistakes as a surgeon? Yeah, I'm quite sure I did. Have you heard the acronym HALT? Hungry, angry, late, or tired. If you're any of those things, you're more likely to make a mistake. When I was a surgeon, I was usually at least 2 of those. I was often 3, and some days I was all 4. So of course I made mistakes. Was there harm done? Yes, I'm quite sure there was harm done. But I don't know, because healthcare has a different relationship with harm than aviation does. It's not really spoken about, it's not recorded, and there's certainly no error management training. So that means our health service staff, as well as being overworked and under-resourced, are left totally exposed to one of the biggest problems in our health service today, human error. I don't think that's fair. I think they deserve better than that, and that's what I want to talk to you about tonight. So how big a problem is error? This is Marty McCarry. He's a professor of surgery and of health policy in Johns Hopkins in the States. So he published a paper this year in the British Medical Journal looking at human error in the American health service. Now, he only looked at the hospital system, not at primary care, and not at the nursing homes. So he starts his paper by acknowledging that his figures, staggering though they are an underestimate. There's a study done in the UK in the last 10 years, and about 7 years ago, the World Health Organization did a huge intercontinental study looking at 13 different countries and looking at 30,000 patients. So it's a fairly impressive study. We've actually got studies going back as far as the 70s, about 40 years, looking at this. And the interesting thing about these studies is that they all come up with very similar numbers. Now, in Northern Ireland, we're not actually measuring human error, so we don't really have figures for here. But let's take the figures we have for everywhere else and apply them to our population and see what sort of numbers are we looking at here. So taking a conservative view of it, human error is causing harm to roughly 400 patients per week in our local health service. About 200 of those are seriously harmed, and it's leading to about 40 deaths per week in our local health service. 40 deaths per week from human error. I think that's mind-blowing. And yet we don't have an error management strategy in place. Marty reckons it's the 3rd biggest killer now in the States, just behind cancer and heart disease. If you apply the numbers here, it's about the same here as well. Yet we have no error management strategy. They've done some preliminary work in the States looking at aviation-type training. It hasn't really caught on, despite the fact that it's shown we can catch between 40 and 80% of human error. Applying that again conservatively to our local population, that means we could save roughly 1,000 lives per year. We could greatly reduce the suffering for patients and for staff, because let's be very clear, our staff come to work intent on doing the best job that they can. We've got some world-class professionals here, and they do their very best, but they're let down because they have no error management strategy. When a patient is harmed, they suffer horrendous harm emotionally and psychologically as well. The suicide rate actually trebles for the 6 months after a staff member has an incident. And yet there's no error management strategy in place for them. So what can we do about this? We can reduce those deaths, we can improve the quality of life, for the staff and patients. But what about the finances? Can we afford this? I think, looking at the numbers, we can save about £20 million a year in compensation alone, and probably 3 to 4 times that in total costs. So money's not an issue here. So before I go on, I would just like to clear up a fallacy about error. In our society, it's felt that human error happens to people who are not smart enough or didn't work hard enough. That's not true. Let me give you a few examples. So I like to watch Formula 1. Any Jenson Button fans in the audience? Jenson Button was the World 2010 Formula 1 champion. In 2011, in the Chinese Grand Prix, he pulled into the pits for a tyre change and straight into the Red Bull pit, which is a pity because he was driving for McLaren that year. But that was a one-off. Any Lewis Hamilton fans in the audience? Lewis Hamilton's a 3-time world champion. He spent 6 years with McLaren and in 2013 joined Mercedes. And in the Malaysian Grand Prix of that year, he pulled in for a tyre change too and straight into his old McLaren pit, and then had to drive straight back out again and find the Mercedes one. Anybody here watched the Miss Universe final last year? No, I wasn't. I saw it on the news the following morning. Centre stage, first place, Miss Columbia, delighted with herself, wearing her new crown and her sash, holding her flowers, when Steve Harvey, the presenter, stepped forward. He said, "I've made a mistake. Miss Columbia's first runner-up." So she had the crown and the sash and the flowers over to Miss Philippines. We're here in the Great Hall in Stormont tonight, home of Northern Ireland politics. So I'm guessing a few of you were probably watching the first US presidential debate on TV a few weeks ago, televised to 100 million people. The invitation card had the names of the 2 candidates on it. You'd think they could have spelt the names correctly. Hillary with 1 L. So I think we can see human error happens in all walks of life. It's inevitable. It happens at the very highest levels. It's no respecter of rank. So coming back to our system in aviation, how do we deal with error? Pilots are simple creatures. We've only got 3 brain cells, so we try not to overload them. Everything's done in 3s. The most important thing is our culture. Instead of a name, blame, shame, and retrain culture, we have what's called a just culture. That means if I make a mistake at work, I can put my hand up and report it without any fear of retribution or disciplinary action from my company, as long as it's not gross negligence or deliberate harm. It's not a get-out-of-jail-free card either. We then take that error and look at our systems and see, how did that happen? And we almost always find a tripwire. We then engineer that tripwire out of the system and replace it with a safety net. And crew resource management is our overall operating philosophy for applying that framework of error management. Now, when I say crew, we have a very broad definition of crew. We don't just mean the pilots, we also mean the cabin crew, the engineers, ground staff, air traffic controllers, and you, the passengers. You can see things that I can't see. I'm the captain, but I can't see the engines. If you see something you're not happy with, it's your responsibility to speak up, and that's then incorporated into our error management system. Similarly, in healthcare, we're not just talking about the doctors, important though they are. We're also talking about the nursing staff, all the allied healthcare professionals, admin staff, managers, and again, you, patients, and their families. Healthcare is not a spectator sport anymore. If you see something you're not happy with, it's your responsibility to speak up. Don't assume the staff members noticed it. They're trying to look after 30 or 40 people at a time. They might not have noticed it. So we can simplify our safety net system down even further to avoid, trap, mitigate. We go to work expecting to make mistakes, and we have safety nets in place to trap them. We also assume that we're going to miss it, so then we have a second safety net, and a third safety net, and a fourth safety net, and whatever it takes. We also assume that some days we're not going to be at our best, so we also have a 2 brain cell model. Where can this go wrong, and what's plan B? Now that's a deceptively simple looking model, but that actually can work for any high-risk industry run by human beings, any complex industry. That'll apply to the police system, it'll apply to farm accidents, it'll apply to road safety, but tonight we're going to apply it to healthcare. Now, I often get told by the doctors that it's too simple. Patients are much more complex than airplanes. And they're right, they are. They're infinitely more complex. But that's not what the system's about. A very small part of my job is about flying the airplane. My main function is managing a complex, high-risk environment. My main role is to trap error before it can go and cause damage. If I can catch that error in time, we can avoid the accident. It's all about time. To prove the point, I invited one of our consultant anaesthetists from Belfast to join us in the flight deck about 2 years ago. So she came on a flight from Belfast to Heathrow and back with us to sit in the cockpit just to see what exactly do we do up there all day. So by the end of the day, we had another convert. So I'm going to give you an example of how it actually works in the real world. Firstly, the medical system. You've probably heard of Dennis Quaid, the actor. Dennis Quaid and his wife had twins a few years ago. When they were 7 days old, they were admitted to the hospital with a severe infection, which was treated with an intravenous drip in their arm. Every 6 hours, that drip was flushed with a very dilute blood thinner called heparin to keep it open. That was fine, except that the hospital had 2 bottles of heparin in the cupboard that day. They're identical size bottles, identical shape, very similar labels, similar writing, and similar shades of blue. The main difference, though, is that one bottle was 1,000 times stronger than the other. Can we see where this is going? So the 7-day-old babies were overdosed with a blood thinner 1,000-fold, twice in 6 hours. Now, they were lucky there was no long-term damage done. When it was investigated, it turned out that the same incident had happened in the States 16,000 times in the previous 6 years, but nobody thought to remove the tripwire. So how do we use it in our system? This is the side stick I use to fly my Airbus. There's one button on it, and it's coloured red. In our society, red means danger. Don't push that button. That disconnects the autopilot. But we assume that I'm probably going to bump against it by accident someday, so then we run into trap. A red flashing light in front of my face and a triple chime alarm to get my attention. You say, hello, you've disconnected the autopilot. But we assume that I'm having a very bad day. I've missed that as well. We have about another 4 or 5 safety nets beyond that to stop me getting to the stage where I have an accident. That's how we apply our system. And the same system can be applied to our healthcare system. So, in summary, what can we do? There's a number of things we can do. Firstly, as a society, we need to be more accepting of error. We live in a very complex society with a lot of high-tech equipment. Things are going to go wrong. We have to accept that and buy into that. We have to acknowledge that people who make mistakes aren't bad people. It's not that they weren't smart enough or didn't work hard enough. They're just human beings. We have to be more accepting of that error and not rush to apportion blame and demand retribution. I think our staff deserve better than that. As patients, we all have a role to play. We need to speak up. As I say, healthcare is not a spectator sport anymore. If you're not happy, speak up and say so. You need to point out if things are going wrong. And lastly, pilots. We have a great toolkit that we use for dealing with error, and we'd love to share it with the health service if we're given the opportunity. Between us all, I think we can transform healthcare in the province. Nobody else worldwide is really teaching error management training. We can be the first. We can lead the world in this. We can make a huge difference to patients, to staff, and to the accountants. We can keep everybody happy. A very rare win-win-win situation. It's between us all, we can create a good news story for our health service. I think we all know that's about time.